My initial thought in pursuing reading buddies for public health home visitation was to provide some distraction for the public health nurse. It's real easy for the other children in the home to kind of compete for the nurse's attention during the visit, and we are visiting high-risk and special needs babies. So I began to negotiate with the siblings that if they'd let me work with Mommy a little bit, then before I left I'd read them a book. Well, it worked, but it wasn't enough. So we were able to work with the administration here at the health department and get it approved to add reading buddies as a volunteer option for health department volunteers. So we've trained them in some early childhood literacy skills, and I started taking the reading buddies out with me on home visits, especially in the homes where there are siblings.
For me, it has been impacting to my life, because I think that everybody gets in their own bubble and don't really pay attention to other people's lives out there. And, it can be a reality shock, but it's also, I love working with kids, and I think it is such an honor to just be able to see them and to read to them. It is very important to me. I read to my children, and I strongly recommend to all my family members and friends to read. I think it's so important. And, some of these homes don't even have books in their homes. So to be able to go in there and read to children is a huge, huge blessing.
With one particular family, I realized that the children had no access to books in the home, and they really had very little exposure to books. So my reading buddy really had her work cut out for her with that family, just to get the children engaged and interested in reading on the visits. Didn't take very long. They got to the point very quickly that they would run to the door when I knocked and throw the door open and say, "Where's Book Girl?" And it got to the point that it was hard to make a home visit without Book Girl because they missed her so much.
They do, Book Girl. Yeah, that's the name, Book Girl. I do not have an actual name now. I have said a couple times, they'll ask my name and I say Amanda, but I'm still the Book Girl. I think I'll always be now.
Up in the hayloft of the barn, Penny laid an egg. The egg rolled through a hole in the floor to a room down below.
Hey!
"Oh my, hope I haven't lost it," she said. "Where do you think it went?"
Right there,
"It went down there." "Yeah."
I saw.
"You'll see. Remember at the end? We have to wait till the end to find out." Penny rushed down the stairs to the room below. "Have you seen my egg?" asked Penny.
The children in the homes where we take the reading buddies get attached. They anticipate, they look forward to our visits. I noticed that during my time in the home, the oldest little girl frequently would come out and say, "We've decided to keep Book Girl here for a while. You can come back and get her later." And I would always have to explain that Book Girl had to get back to work. And the mom told me that the children started about 2 days after the visit was over, they started asking when was Book Girl coming again. And when I knock on the door, you kind of hear the little thunder of multiple feet as they run to the door and throw the door open. And it's not, "Hey, yay, the nurse is here," but it's Book Girl. And they just can't wait to get her in their little room and sit on the floor and see what books she's brought to read. We really are working together as a team to try to help all of our clients meet that health department goal of having longer, healthier, happy lives, and that we're not just looking at the client or the baby that is our client, but we're trying to meet the needs of the entire family.
It's a blessing, it's rewarding, it's comforting, and it's getting to know people out there that you wouldn't normally interact with on a day-to-day basis, and being able to sit there and talk to them, get to know them, read to them is just a huge, huge moment for me in my life, and growth for me. I have grown to, love my children, I think, more over the program, read to them more. I have taken them to the library more. So it's not just about the impact of the children or the family or the nurse, while they're there. It's also about the volunteer and, the impact that it can have in your life. It's even my husband has commented, I can see the depth behind it. It's something so simple can change your life.